to compare apples to apples.
Federal health officials now say nearly 4,000 Americans have died from the H1N1 virus since it first emerged in April. Previous estimates put the number of fatalities at around 1,000, but the death toll has been recalculated to include deaths from flu-related complications such as pneumonia and bacterial infections. The CDC estimates that 22 million Americans have gotten the virus, and close to 100,000 have been hospitalized. 8 million children have been infected. 540 of them have died. The CDC's Dr. Anne Schuchat calls these numbers alarming.
We have already seen a larger number of deaths than we've had for several years. I do believe that the pediatric death toll from this pandemic will be extensive and much greater than what we see with seasonal flu.
Last week, the World Health Organization announced that more than 6,000 people worldwide had died from the H1N1 flu. The WHO says that as of November 1st, some 200 countries and territories have reported close to 500,000 confirmed cases. WHO officials say the actual number is probably higher. Dr. Schuchat says people in high-risk categories, such as those with diabetes, have to be especially cautious.
When people with diabetes get flu, it can be more difficult for them to manage their blood sugar. They can suffer high or low blood sugar. So paying special attention with flu when you have diabetes is important.
Many doctors say the H1N1 vaccine is the best protection against the virus. The problem is, there's still a shortage. The only company making the vaccine in the U.S. is behind schedule. But supplies are expected to increase before the year's end.
As the supply increases, we do think that access and convenience and ease of getting vaccinated will improve.
That's little comfort for Margaret Savitz. Her husband Walter contracted a serious case of H1N1.
By Saturday night, he couldn't breathe. He was having a really hard time. And by 2 a.m. Monday morning, he was in full respiratory failure.
The H1N1 virus is different from normal seasonal flu in that it persisted during the summer months and affects relatively healthy people. For producer Vidushi Sinha, I'm Carol Pearson, VOA News.